Welcome to the Best of Frederick County. Today we have a proclamation to recognize National Minority Health Month, and we have a number of people joining me from the community who are regular advocates to address health disparities in our community and really just improve the health of everyone who lives here. So I'll start off by reading a proclamation. Whereas the theme for National Minority Health Month in 2015 is 30 years of advancing health equity, acknowledging the efforts of the U.S. Department of Health and Human Services towards eliminating health disparities among racial and ethnic minorities. And whereas this year marks the 30th anniversary of the report of the United States Secretary of Health and Human Services Task Force on Black and Minority Health, created by the first convening group of health experts in the United States to conduct a comprehensive study of racial and ethnic minority health issues. And whereas during National Minority Health Month, we join together to raise public awareness about health and healthcare disparities and highlight national and local efforts towards eliminating these health disparities and to advance health equity. And whereas during the month of April, we applaud the commitment of all of our federal, state, tribal, territorial, and local partners to take action toward ending health disparities in their communities. Together, through collective efforts, we can accelerate momentum towards achieving a nation free of inequity in health and healthcare. And I really want to take the opportunity to acknowledge all of our local partners for all of their work in holding multiple health fairs, including an annual health fair which serves over 1,000 people and brings over $500,000 worth of health care services to people in our community in just one day. So now, therefore, as the County Executive of Frederick County, Maryland, I hereby proclaim the month of April 2015 as National Minority Health Month in Frederick County and do commend this observance to all of our citizens. I know there's a lot of people here who work on this issue and who want to speak to it today, but we'll start off with some comments from Elizabeth Chung, who's the Executive Director of the Asian American Center.
Thank you, Executive Garners. It was really my pleasure to be here today. I didn't realize it was 30 years ago when I started this, and it just brought back memory. That was in Ohio. So I haven't stopped. So with this movement that we have, we continue. Frederick County is so wonderful because of all this, partnership that we have, bringing awareness, to improve the quality of life and also to reduce health disparities. I would like to bring my greetings to you, on behalf of Ali Gist, and she is the director for the Minority Outreach and Technical Assistant. Actually, she is the director, let me put it right, it's Department of the Minority Health and Health Disparity. And it is from the state level. And this is funded the MOTA program, which is Minority Outreach and Technical Assistant. I have to say that this is a model that really worked for us in many years. It's been 9 years now in Frederick County. What it does is that it tries to start out with mobilizing the communities, pre-engaging the communities, providing some technical assistance, and then together we build capacity. It takes a village to raise a child, but it takes the whole Frederick County to really do what we can do. It's not the Asian American Center, it is really all of us. So it's just on this special date, I just want to extend, my sincere, gratitude to all of you that make this happen in terms of reducing disparities in our county. It has been really doing better. More people getting access to health care, more people getting, communication with the doctors, and we're addressing the issues of HIV and hepatitis B and so forth. So I'm going to let some of my colleagues to talk about the great work that we did together in Frederick County with the support of our government, with school, with our Department of Social Work, with our citizen services, with the health department, and all of us. So they will do the talking. I know that I better pass it on and let others to just talk about the great work of really minority health and the women's health and so forth in Frederick County. I just don't want any place else but just Frederick. So thank you, Executive Garner. So I want to probably start over this way then. And I saw,
Angela. Angela came in, so I'll pass it over to her. We'll start with
Sure, absolutely.
Hello and good afternoon. Good morning, everyone. First and foremost, County Exec Jan Gardner, thank you so very much for recognizing this month as Minority Health Month. As I'm sure it's already been stated, we are very excited that this weekend the community is coming together again to host a Minority Health Fair, which will be this Saturday morning from 9 a.m. until 1 p.m. in the afternoon at Asbury United Methodist Church. Very excited with all of the different agencies that are coming together, from the YMCA to Dr. Medical's office to FMH to Bridges. I could go on, but there will be something for everyone. And what's so exciting with the Face Striders, an organization that I represent today, we're incorporating the Let's Move campaign in the midst of the health fair. So we're inviting everyone to come at 9 and stay to 1, because all throughout the morning there will be various increments of opportunities to move, from Zumba to cardio to line dancing to yoga. So we just want to move and just get involved. And as our flyer says, we're promoting health for all. So I encourage everyone under the sound of my voice to be in attendance, and those by view also. So thank you again. And Elizabeth Chung, thank you for being a trailblazer in our community to promote health care for all.
Hi, I'm Christine Ferguson, representing Frederick County Commission for Women, and we are here to just lend our support and promote women's health.
Everybody can introduce themselves and maybe go back behind
Okay.
and let everybody just at least say who they're with.
I'm Alex Yang. I'm an intern at Asian American Center.
I'm Yun Chen. I'm also with the Asian American Center.
I'm Patsy Torres, and I'm also with the Asian American Center.
I'm Annette Breeling with the Human Relations Commission, and also with Healthcare is a Human Right.
I'm Gurpreet Kaur from Asian American Center, and of course I echo what Elizabeth said, and all say I think minority, or whether or not minority health, I think is an important issue.
Frank Matthews, Asian American Center.
Pat Rosensteel, Citizen Services Division of Frederick County Government.
Dr. Hin Lo, MD from Africa, here doing community baby shower in Asian American Center of Frederick, and now in the community for interpretation service in the same agency. Thank you.
My name is David Lee, and I'm a pastor and also a FMH interpreter.
I'm Jennifer Salisbury, and I'm with the Asian American Center of Frederick, and I work specifically on the Alcohol Prevention Initiative to keep youth from drinking.
My name is Willie Gardner, and I'm a member of Asbury United Methodist Church, a member of Face Striders, a member of Alpha Kappa Alpha Sorority, Negro Business and Professional Women's Club, and the whole Frederick community. And I am just so proud and honored to be a part of this, because health is such an initiative. It should be for all of us. And we want to make sure that the minority population know that health care is available to them, to us, I should say. So with that, I'm with Asbury, and we are hosting the African American Fair on Saturday.
Okay. You do have to hold the microphone up to be heard.
I'm Debbie Ann, and I am with the Health Department. I run our HIV program. Maryland continues to be the #1 state in the country for the number and rate of AIDS cases, with huge disparity among people of color. So I'm very proud to be here this morning and to speak for health care for all.
My name is Joyce Richardson. I'm with the Frederick County Alumni Chapter of Delta Sigma Theta. I'm a member of the Physical and Mental Health Committee, and we're just pleased to be a part of all the great efforts here in Frederick County.
Good morning, everyone. My name is Miriam Dobson, and I supervise maternal and child health at the Frederick County Health Department. We serve 2 robust programs, one of which is called Special Delivery, and the other is our WIC program. Did you know that in Frederick County and with the rest of the country, an African American baby is 2 to 3 times more likely not to survive until their first birthday? There's a lot of work ahead for us, and we are in the forefront of trying to bridge the gap and reduce this disparity.
Good morning, everyone. My name is Tanya Davis, and I'm a member of Frederick County Alumni Chapter of Delta Sigma Theta Sorority Incorporated, where I sit on the International Awareness Committee, and our focal point is really to get the word out about AIDS awareness and HIV training and getting our members in Frederick County just to get tested, just to find out where you are. And the more people that know, they can teach someone else. So healthcare initiative is very important to our sorority, and we want to just help and do our part in Frederick County.
Hi, good morning, everyone. My name is Mary Jackson, and I'm part of a great team from the Health Department, the Preventative Health Program, and I'm also a member of the Face Striders. Basically, my message is, one, to thank everyone for your participation, going out into the community to make it inclusive, and my final word is that the mantra within our program is screening saves lives.
I'm Randy Culpepper, the Deputy Health Officer of the Frederick County Health Department. I just want to mention that this is National Public Health Week, and each day of this week focuses on a significant public health issue across the country. And yesterday, the very first issue that was highlighted was health disparities. And this is an issue that can only be solved through multiple coalitions and efforts among all the great people that are here today. And it's going to be a hard one to solve, but I'm really proud of the work that I know that our health department and, of course, Elizabeth's group and everyone else does in this community to help solve the issue of health disparities.
Hello, everyone. My name is Eric Ireland. I'm with the YMCA of Frederick County, and we're extremely excited about supporting such a great cause, and just very happy to be here.
Good morning, everyone. My name is Beth Mowry. I'm also from the Frederick County Health Department. Very pleased to be here today, and pleased we've done some collaborative projects with Elizabeth and Faith Striders and other community partners here looking at cancer incidence and mortality, particularly in our minority community. So it's been a pleasure to have worked with these partners and hope to continue that. Thanks.
Thank you. Good morning. My name is Bob Howell, and I'm with the Center for Vein Restoration. I'm just so honored and humbled to be here with all these hardworking and passionate people working to improve the health care of folks in Frederick County. And I want to thank the county executive and Elizabeth for their leadership, and we're looking forward to get more involved in these type of events. Thank you.
Thank you, everyone, for being here. You know, I know some of you individually have really been leaders to try to bring health care to people in our community, but collectively, it is a great effort, and we have a ways to go, but we have a lot of people committed to make it happen. So I want to thank you for all of you, what you do individually in our community and what you're going to continue to do collectively to make a difference, because together we can make sure that we have a healthy community. And we are pleased to have ranked very high in terms of quality of life and health in Maryland. We were ranked 3rd out of the 24 counties in the state. And I think our health department and all of you should be congratulated for that accomplishment. And the Elizabeth reminds me that the health fair is October 24th, and is it at the Frederick Fairgrounds again? And there's always over 1,000 people who attend, maybe 2,000. It gets bigger every year. And there's a lot of information provided, as well as health care screening and other health services. You get a flu vaccine. You can get tested for a variety of things like diabetes, et cetera. And not only can you get screened for it, but if you are identified to have a problem, they'll make sure you get follow-up care for it. So it's really an outstanding effort, and there are many, many people who are engaged in that, but certainly the leadership and the energy and the drive comes from Elizabeth Chung, and we really want to thank her for all that she does, in particular in our community. So if anybody in our viewing audience would like to get involved, they can contact me at the county. They can contact Dr. Brookmeyer at the health department. They can contact Elizabeth Chung at the Asian American Center. We're all here to try to move our community forward, because we know a high quality of life depends on good health. So thank you for joining us today, and thank you for making a difference in our community.